Hello and welcome back to Real Talk with Jesse and Sherrod. Unfortunately, it's just me, Sherrod, today. Jesse is not feeling well. So lots of love to Jesse. I hope you feel better soon. And I miss you already for this episode. So I'm just going to do a quick episode on what we had planned for today, which was to talk about 211 and 211 Day at the Capitol. So today in Louisiana, we had 211 Day at our state capitol. So I want to review with y'all real quick about what 211 is, and then I'll talk a little bit about what we did today. Um, so 211, like 988, is a national FCC designated three-digit dialing code where you would just dial 211, or you can text your zip code to 898211. Now, the difference between 988 and 211 is that 211 is an information and referral line for health and human services. However, similar to 988, that is a national line, like I just said, but a local service, and you are geo routed to your local 211 centers. Um, 211 is covered all across the US. But for now, for today, I am going to talk about 211 in Louisiana specifically because that is what I know about. And as we know, everything operates a little bit differently from state to state, depending on your state's needs, your state's funding, who operates your 211, etc. So I highly recommend if you're listening from out of state, you should be able to just Google it. Google your state's 211, who operates it, and get in touch with them to learn more. But I'll talk to y'all now about Louisiana's 211 system, which is something we're very proud of in Louisiana. So 211 was designated by the FCC as an official three-digit dialing code in 2001. So again, 211 is an information and referral line for health and human services. So 211's in Louisiana. We have the Louisiana 211 State Network. That is comprised of 7 different regional 211 resource centers. So, what the 211 centers do is to create and maintain the resource database that is utilized when you dial 211. And then on top of that, we have the local contact centers, which answer the 211 line and use the resource database to provide those actual human service resource information to our callers and to our texters. In Louisiana, 211 calls are always answered by a live person, never ChatGPT, never a bot, never AI. And when you text your zip code or the zip code you are looking for resources in to 898211, you will also be reaching a live person. Even though it is a text, it is a live person. What we also offer in Louisiana is the opioid option for 211. So that would be when you text the word opioid, 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 yes, to 898211. That is a statewide available line in Louisiana to receive resources and information related to recovery and substance misuse with opioids. That is the only option where you can choose to speak to a bot. You don't have to, but if you would prefer to speak to an automated bot, you can do so, or you may choose to speak to a live specialist, in which case you would be routed to us at ViaLink at our 211 center. So ViaLink is proud to be one of these 7 211 centers, and we are also one of the 211 contact centers as well. So we are very proud of that. We serve 10 parishes in the southeastern portion of Louisiana with our 211 contact center and 211 resource database. So first, I want to start with the resource database of 211. Again, these 7 different 211 areas that we have in Louisiana are operated by different agencies and different streams of funding. If I'm remembering correctly, 5 of them are maintained and operated by District United Ways. And then ViaLink is who funds and operates R211 for our 10 parish area. And then the 211 in the Lafayette area, which is called 232 Help, also maintains and operates their 211. That is their resource department as well as their 211 contact center. Again, there in Lafayette, it is 232 HELP, and that is the number you would dial to get connected to them. So the resource departments that work for these 211 centers are incredible. So for now, I'm going to speak directly about ViaLink and ViaLink's resource department because that is what I know. That is where I work. So our internal resource department creates and maintains our resource database. For those of you who do live in Via Link's 211 area, again, that's going to be the 10 parishes around the metro area in the southeast part of the state. You can look it up on our website. It lists it. You can also find the 211 parish map on Louisiana211.org. But I cannot speak highly enough about our resource department. Special shout out to Andrew and Deanna, who are the leaders of the resource department. They do an incredible job. So our resource department works internally in ViaLink, and they keep our resource database up to date with verified resources, and they are also constantly mining new resources. And we have thousands of resources within our 211 database. A side note on ViaLink, we also publish our entire resource database for free. So that is our regional 211 resource database, as well as our statewide 988 behavioral health resource database on our website, access for free on vialink.org under Explore Our Resources, or excuse me, Our Resources. Also, under that Our Resources tab is an option to add or modify your agency's resource listing. So, if you are a human service agency in Louisiana and you want to be added to ViaLink's resource database, you can do that just from our website, vialink.org, under Our Resources, add your agency. And we really rely on that because we can only give the resources out to individuals that we know about. Our outreach department works a lot to be sure that we are sending resources that we learn about to our department at coalition meetings or health fairs and things like that to be verified by the department. And the contact center, which is what's so great about these internal resource departments, can also relay the information to our resource department. Like, we're getting all of these calls for this type of service or asking about this agency, and we don't have it listed. And then they can work to try and solve that sort of miss that we might be having. So all of the resource departments in Louisiana are accredited by an agency called Inform USA. Inform USA is a national information and referral accreditation agency. So it's not just an internal resource department, they are trained and qualified for the work that they do to have valid, verified resources within our database. So what types of resources does 211 have? That is human service resources. That's going to be things like rental assistance, housing assistance, transportation, legal assistance, food assistance or food resources. That can even be things like finding a healthcare or behavioral health care provider, really any sort of human service need like that. So we don't create the resources, but we help connect people to them. So if you dial or text 211 and you are looking for a human service resource, you're reaching that real person who has been trained by the resource department on how to navigate this very organized and a very fancy way with taxonomy terms that our brilliant resource department keeps up with so that the contact center specialist may easily navigate and find these resources. You are talking to a real person, so you don't need to know acronyms. You don't need to know the jargon of whatever field you might be looking for services in. You just get to talk about what's going on with you and what your needs are. And that person is going to be able to navigate the resource database for you and give you the information you need to be able to access this resource. So that will, of course, be like the agency name and the phone number or email address, however you get in touch with them, but also things like what demographics do they serve? What hours of operation do they have? What type of documentation do you need to bring with you? And if you're texting with us, of course, that information will be texted to your phone. But even if you're talking to us on the telephone, we can text all of that information to your phone. And if you're navigating our resource database on our website, again, vialink.org, VIALINK.org, you can also email or text the resource listing to yourself or to someone who needs it. There are no barriers to accessing 211. It is there for any age and it is there for just anyone in the community. Or also sometimes, providers or care navigators may utilize 211 to be able to help to find the appropriate types of referral for their clients. But no barriers, anybody can use it. 211 is free to access, as again is our online resource database, and it is available 24 hours a day. So no appointments to upkeep, and you can access that knowledge and information whenever it is that you need. Now, it is important to remember the distinctions between 211 and 988. 211, you are reaching a resource specialist, someone who is going to connect you to a human service resource. 988 is that person who has all of the training in emotional support, crisis intervention, suicide intervention, that real like I need to talk to someone type of moment. So when in doubt, if you're confused between the two, I recommend just dial 988 because the two systems work together really well in Louisiana. So if you dial 988 and you will be better served by 211, we can easily do a warm handoff to 211. You wouldn't necessarily want someone in a heightened crisis to reach a 211 resource personnel who maybe wasn't trained in how to address that in that moment. But again, if you can keep them straight, then you just remember 211 is because I would like a resource referral. 988 is basically for anything else that you need when you need to talk to somebody. But 211 is truly a great service. Again, just for those in the community. If you have a friend, a family member, a coworker that you want to help out with trying to find some resources for them, or again, if you're a provider, a healthcare provider, behavioral healthcare provider, care navigator, whatever that might be, you can also utilize 211. And I just encourage anybody who works in any sort of human service field, please find your 211 center and make sure that your agency is in their database. 211 gets thousands of calls a month. It is a really amazing resource that is connecting people. Again, these resource databases are verified. Our resources are verified minimum annually, food resources twice a year for us at ViaLink. And the beauty of these internal contact centers being anytime, internal resource departments being anytime, if let's say someone calls us back and says, I called this number, it doesn't work. We can let the resource department know immediately and they can pause that resource until we can get it re-verified. So we don't have to wait for the information to trickle down from anywhere. It's not just this once a year time that all of the resources are being verified. It's not just once a year that we look for new ones. It is an always evolving, ongoing resource database, which is really, truly amazing. For us in Louisiana as well, on ViaLink's website, vialink.org, we do publish our aggregate data, as we've talked about before, for 988. We do so with 211 as well, which we call our data for good because it means that other agencies or advocates can use that data for a policy change or for funding requests. That is real-time data. So you can see who's calling and what are their needs. And we also even have an unmet needs data dashboard. So meaning if you were looking for some sort of funding and you needed to be able to display that there is a need for this and it doesn't exist in your area, you can look on our unmet needs dashboard and see if we are getting calls in your area for such resource and it's not there. So please explore our website, vialink.org, look at the resource database, look at the data dashboards, and please spread the word about 211. It is an underknown resource and it is so incredibly valuable. That's why we were so glad to have 211 Day at the Capitol today. A big thank you to Sarah Berthelot, our Louisiana 211 leader, for organizing the day where we had an opportunity to talk to visitors at our state capitol as well as our legislators, last day of legislative session, to just spread the awareness about 211. And as always, it is something that does need funding, these human service needs. So if you are so inclined, please reach out to your local legislators, talk to them about 211, talk about the funding. I thank y'all so much for your time today. I just wanted to have a quick update with y'all time today. I'm acting like I'm in a meeting with you. I am in a meeting with you. I thank you for being on Real Talk with me today. Really miss you, Jesse, but thank you for all of our Real Talk listeners. This has been Sherrod Crespo today for Real Talk. No filters, no fluff, just Real Talk.